Hello everyone, welcome back to my YouTube channel. Today I'll be talking about some indications for cesarean section. I'll be talking about some indications that will make the doctor decide that a woman is going for cesarean section. The first thing I'm going to be talking about is cord prolapse. Cord, which is also known as the baby's umbilical cord, may slip out, and most times when it happens when the woman is already in labor, when the cervix is already open, the cord slips out. And in such situation, if a cesarean section is not done for the woman, the baby's head may press the cord, which may restrict oxygen supply to the baby, and it may lead to the death of the baby. So it is important that a cesarean section is done to bring out the baby as soon as possible. The second thing I'm going to be talking about is fetal macrosomia, and simply put, that fetal macrosomia means that a baby is just simply too big to pass through the mother's pelvis. The third thing I would like to talk about is cephalopelvic disproportion, and this is when there is a disparity between the mother's pelvis and the baby's head. Means the baby's head, it's either the baby's head is too big to fit into the mother's pelvis, or the mother's pelvis is simply just too small to accommodate the baby's head. In such a case, a cesarean section is done for the woman. The fourth thing that may warrant a cesarean section is placenta previa. Placenta previa is when the placenta is low-lying, when the placenta is covering, and there are different grades of placenta previa, but it simply means that the placenta is the presenting part. Instead of the baby to be the one presenting, the placenta is what is presenting, and the placenta is covering the mouth of the cervix. And in such situation, a cesarean section is done to bring out the baby. Vaginal delivery may sometimes even be impossible, depends on the grade of placenta previa that the woman presents with. So the fifth thing I'll be talking about is prolonged labor. Gone are the days where women say, my mother labored for 5 days before giving birth to me, my mother labored for 4 days. There's a time estimate in which a normal labor should occur, and when it's going above this time, they are going to do cesarean section. A cesarean section is done for the mother in order to save the life of the baby and the mother. Nobody is going to allow any woman go through pain for 3 days performing a cesarean section. The sixth thing I'll be talking about is maternal health. There are some certain health conditions that a woman may present with that may warrant them doing cesarean section for this particular pregnant woman. The seventh one is malposition. A baby that is not properly positioned in the uterus. For instance, a baby that is lying transversely, meaning the baby is lying this way, or any other position that is not favorable for delivery, for vaginal delivery, may determine whether a woman will go through cesarean section. Next thing is multiple pregnancies. Multiple pregnancy is an indication for cesarean section most times. For instance, multiple pregnancy simply means that a woman that is carrying more than one baby. Next thing is previous surgeries. For instance, a woman that has done multiple surgeries before, it's not advisable for that woman to go through vaginal delivery in a subsequent pregnancy. So previous surgeries is an indication for performing cesarean section on a woman. And the next on my list is placenta abruption. Simply put, a placenta abruption means that the placenta has detached from the place it was embedded in the uterus. An emergency cesarean section is performed for such a patient when it is discovered that the placenta has detached from the place it was embedded, and that condition is known as placenta abruption. The last on my list is fetal distress. Just as I mentioned in my previous video, that fetal distress is when the baby is in distress in utero, and most times when a woman is in labor, the heartbeat of the fetus the baby is being checked. So when it is noticed that this baby's heartbeat is going too high or too low, above normal or below normal, a cesarean section is performed, because this baby may not even, if a baby is in distress in utero, it simply means that this baby may not be getting enough oxygen in the uterus. And just imagine a baby not getting enough oxygen in the uterus, that means that the baby's health is at risk, or the life of the baby is at risk. So a cesarean section is performed for this particular condition. So we have come to the end of this video. Thanks for watching, guys. In case you found this video helpful, kindly give it a thumbs up, subscribe to my channel for more health education videos, share my video with other moms to be, as knowledge is power and it may end up saving lives.